Hi, my name is Christine Woda, and I'm going to be going over a case to start for my pharmacology class. So, the case that we were presented with is of a patient, a woman who appears disoriented, angry, and so that's going to be the first case that I'm going over. So, with this, the patient appears to me to be drunk. She may have a chronic drinking problem. It may even be homeless due to her appearance, in that she smelled and the state of her clothing that was described in the case. The patient, I feel, first needs to be evaluated for injuries she may have sustained when she fell. It was said that she had serious scrapes on her arms and on her face, and I think that those need to be addressed first. The patient appears dirty and smells of body odor. If the patient is in fact homeless, the rate of bacterial infection among this population increases dramatically. Scabies, body louse infections, and other louse-borne diseases are more prevalent due to the person's inability to both bathe regularly and to actually wash her clothes. The patient may need antibiotics to reduce the risk of infection due to the scrapes and wound care, which will need to be addressed first. I think there are many long-term health risks that will arise for this patient. Alcoholism is suspected by me and should be addressed. With alcoholism, cirrhosis of the liver was my first inclination due to possible long-term alcohol use. And another cause of cirrhosis of the liver is hepatitis. And hepatitis is prevalent among the homeless population. And that was found at the Mayo Clinic staff on their website. In addition, there are many health risks associated with living outside, and that includes infection, disease, poor nutritional health, orthopedic problems, lack of rest, inadequate means to receive health care. So I think all of those would need to be addressed for long-term care. The patient's hands are shaking, possibly because of long-term alcohol and experiencing DTs. When a patient experiences DTs, they're disoriented, confused, agitated, panicked, paranoid, and they'll usually shake, and those can all be associated with the combativeness and the confusion that was reported in the original case. I think that the patient needs to be assessed by a licensed social worker, and they should assess their living situation and also the degree of alcoholism, how much they're drinking on a daily basis. So if alcoholism is there, and that would typically be done by either the MASG test or the audit. And so they're both effective in screening for alcohol. And so I think that from there, a safe detox program or possible, depend upon the living, the insurance or Medicaid situation. And I think that there also may be city-centered programs, which I know that are available in most cities for low cost. So I think that that would be the best route of care for this patient. Unfortunately, I think in most of these cases, they're triaged and sent on their way without the proper care. So that is regarding the case. And then I'm going to now move on to the research question regarding mental illness management. I believe that our mental illness management is in a state of dysfunction. Insurance does not offer adequate benefits. Facilities are sparse, and ones that do exist are filled to the maximum. There aren't systems in place to communicate between the psychiatrist and the therapist, and there are too many mentally ill that are just thrown into prison systems and aren't given appropriate care. And the middle class and wealthy seek treatment that is either not available or can even be too costly for them as well. And I just think that our mental illness program needs a complete overhaul. So it dates back to the deinstitutionalization back in the 1950s and 60s, where we tried to get rid of the psychiatric hospitals because there wasn't proper care, and I get that. But I think that what happened, I mean, I know what happened there is that we lost a lot of our in-bed and inpatient facilities. And so actually, according to the Center for Prisoner Health and Human Rights, between 1880 and 2005, the number of mentally ill people who went into the prison system jumped from 0.7% to 21%. And a high percentage of those prisoners now leave and end up homeless and still undiagnosed. With a lack of beds in hospitals, we continue to have problems with patients because we have like 6% of all of our emergency room visits include a psychiatric condition. That's according to Ralphson in 2017. Most hospitals reach out to other facilities with inpatient treatment centers, and there's still nothing available. So, and private facilities are upwards of $30,000 a month because they're not covered by the majority of insurance providers. So then you have the idea of outpatient, where you're going to have a therapist and a psychiatrist, and the problem is that the two don't communicate together a lot of times unless they're in the same practice. And so there's actually one study was completed back in 1993 to 94 because there aren't many studies done, but it stated that there was no communication in about 25% of those cases, according to Gitlin and Miklovitz. And so the communication between the doctors is so important to receive therapy when we're diagnosing the brain or mental illness. If we were cardiologists, we'd want to communicate. So I think it should be the same with mental illness. Another reason I think for the lack of problems with patient adherence in education. About 50% of patients don't continue their regimented medication. They just stop taking their medication, which is dangerous. It can cause problems if they stop taking their medication, and it's just not helpful to therapy and to getting them well. And that can be due to cost. It can also be due to, due to the patient being worried because of lack of education, being worried about the side effects of medication. So I think that we need more education. We need better treatment plans where a patient's going to understand what the cost is going to be up front before they start taking a medication. I think that each person's unique, and I think each treatment plan needs to be unique. And so I think that our mental illness management system just needs, like I said, a complete overhaul. Thank you.